Welcome back. Every other Thursday, we're taking a look at a health issue or concern affecting many people, breaking down the information for you and telling you what you need to know to keep you healthy. Dr. Kaleni Brady from the Johnny Burns School of Medicine joins us now with this week's topic, hypertension control and dementia. Good morning, Dr. Brady.
Good morning, Kelly.
Okay, so before we talk about the two together, can you break it down for us first? What is hypertension control?
Hypertension is high blood pressure, and it is very common in the American population and in the Hawaii population. So there are guidelines for control of this. As we know, control of high blood pressure lowers the rate of heart attacks, strokes, kidney failure, blindness, and a whole bunch of other things. What we now know is that tighter control of high blood pressure lowers the risk of progression of dementia and minimal cognitive disorder, which means the pre-dementia component of dementia.
Okay, and then for those who don't know, can you real quick break down what is exactly dementia?
Dementia is basically the loss of cognitive function of the brain, of the ability to think. It also involves loss of memory, and you may have trouble remembering a lot of things that are recent. Long-term memory is usually preserved, but short-term memory and recall are affected with dementia. And then as dementia progresses, you lose the function of taking care of yourself, brushing teeth, washing your hair and washing your body, things that basically we take for granted in terms of self-care.
Okay, and it's interesting. So now we know that hypertension control can actually help out with, I guess, preventing dementia, or at least,
right,
you know, prolonging the chance that you might get it. So how does that work? How does it impact it?
Well, we have recently tightened the guidelines for high blood pressure control. The American College of Cardiology, the American Heart Association have come out with new guidelines for a goal of systolic, or the top number being 120, and diastolic being 80. This is tighter than it was before at 140/90. However, it has resulted at that tighter control in the green line here in a decrease of a lot of diseases, including progression of dementia.
And do we actually know the numbers of the rate that it does help out?
Yes, mild cognitive impairment goes from 7.6% to 6.1%. Now, that may not seem to be a big change, but in a whole population, that's a lot of people.
Yeah, definitely. And then you mentioned the tighter control. How does that, I guess, impact, the general public?
It decreases our risk of those serious diseases. Now, what's the first treatment for high blood pressure, Kelly?
Not eating so much salt?
Oh, Kelly, you get an A.
Yay! I've learned so much from Dr. Brady. So it's funny, the only reason I really know that, well, one from you saying it all the time, but I eat so much shoyu when I eat food, but it's okay because I naturally have low blood pressure. It runs in my family, so I hope it sticks with me.
I hope it does too.
But if it doesn't, what else can we do aside from salt restriction?
And aerobic activity. Actually, any exercise is good. 150 minutes a week is recommended. That's 30 minutes 5 times a week. It can be walking, it can be Stairmaster, it can be jogging or swimming, it can be an aerobic sport like soccer or tennis, a whole bunch of activities, even heavy housework is acceptable. So natural treatment for high blood pressure is the first treatment. But in order to get that number systolic down to 120 or less, then frequently a little extra medicine is necessary, usually the same medicines we're taking, but sometimes at a little higher dose.
Okay, good to know. So, I mean, that's something that's easy for people to do on their own. I mean, when you have lower blood pressure, it will help you out in the long run with, as you were saying, a lot of different diseases, but especially with dementia. You know, that's
right.
Your brain. It's how you're going to be able to function and hopefully be able to take care of yourself. So if that goes downhill,
we're in trouble.
exactly.
Dementia, there are no medicines that reverse dementia.
Really?
There are some medicines that slow progression of dementia, but in terms of actually reversing dementia, there are no medicines. So this is a scary disease. It's increasing epidemic proportions in the United States and in Hawaii, and you want to get rid of it as a risk. This is an easier way to do it than some other risks.
Right, and again, there's no cure, so prevention is everything.
Everything.
Okay, so restrict the salt if you need to, and exercise, move around as much as you can. All right, thanks so much, Dr. Brady.
My
Very
pleasure.
interesting. I did not know those two were connected at all, but they're connected in a big way.
In a big way.
Okay, and we're going to be back with us next week?
2 weeks, yeah, ask the doctor next week.
Okay.
And then take 2 in 2 weeks.
Perfect. Well, then we'll see you here in 2 weeks, but we'll see you on Wake Up Today next week.
Right.
All right, thanks so much, Dr. Brady.
You're welcome.